There are some activities that are, I think, pretty good where you might want to consider. Swimming is always up there.
I agree, but think about swimming like freestyle, for example. In someone who has severe stenosis, they may have a hard time swimming for a while because in extension, which is what you would do in freestyle, their neurological symptoms may worsen. So I would say, listen to your body. If swimming works, then do it. You won't cause any injury if you're not having pain.
All right, what other exercises do you like in terms of just helping? The walking, I think, is something that's very good, low impact.
But for young people like you, walking is not really enough. You know, you should be sweating after exercise.
Okay.
You should be tired. And I'm not talking about just from the Florida heat. I say muscle confusion. Keep it interesting. Change your routine around. If it's the same thing over and over again, besides being boring, it's really just going to exercise the same group of muscles and cause the same issues with certain joints. So changing the routine around, I think, would be my best advice.
Right, because once you start doing a routine every day, like walking,
you got it.
Your body just becomes used to it, and hence you need to use other muscles to kind of wake up other areas, correct?
I agree.
All right. Doctor, how do you diagnose spinal stenosis and lumbar pain? What do you do to determine it?
So usually,
I'm sure when someone walks in, you know. You've seen enough of this, but how do you determine it?
You know, usually it's the MRI that confirms it. But the typical lumbar spine stenosis patient will say, I have no pain when I'm sitting, I have no problem laying down, and then when I get up and I go for a walk, just after a short distance, I can't walk. That's the most common story. Pain-free while sitting, and just in pain, tremendous pain, especially lower extremity pain when they walk. Now, the neurological exam on these patients will usually be normal, and the exam in general is usually normal. Yet, it's specifically during activity that they're suffering, which is why the MRI is so critical to see exactly where there is narrowing in the canal.